I thank the chairman for yielding. And let me just say in reply to my friend from New Jersey that it is the oversight function of this committee and its subcommittees that really has been one of the cherished functions in the Congress of the United States. And certainly under both Democratic and Republican committee leaderships, the oversight function is one that other members of the Congress look to. They look to the oversight function of this committee. So now we are in a new situation where self-attestation is going to be the watchword for people who show up and sign up for benefits. Why wouldn't we have questions about the vast sums of money that have been pushed out the door relatively hastily to these navigator groups? Why wouldn't we have questions as to their credentials, as to their ability to provide what they've been required to provide? And why wouldn't we have questions that other members of Congress would like answered as well? So really it is a function of this committee to provide that oversight function. And I, for one, Mr. Chairman, am grateful that those letters did go out, and certainly in support of the fact that we are trying to simply get the information that the administration, for whatever reason, does not want to give to the Congress.
Would the gentleman yield?
No, I will not. I've got some things to say. If I have time at the end, you may be welcome to it. We have 3 weeks, 3 short weeks, 21 days, ready or not. October 1st, the health exchanges, including the federally facilitated marketplaces run by the Obama administration, will open. While the White House, Treasury, and Health and Human Services continue to report that everything will be ready, everything is fine, we've only seen missed deadlines, delays, and really an overall lack of information. Now, the most significant function for the operation of the exchanges, as it turns out, is not in the hands of the administration, but has been outsourced. It's been contracted to organizations, and many of those witnesses are before us today, and we appreciate your participation. The federal hub will be the center place of the exchanges, coordinating data from over 5 federal agencies, millions of individuals, hundreds of insurance carriers, and in all 50 states. Not surprisingly, the complexity involved in coordinating the exchange has led several states, notably Oregon and California, to indicate that they will likely need to delay access to their online marketplaces. States have begun making contingency plans, but the administration continues the same refrain: we will be ready. Instead of communicating with Congress, the administration has decided just to open the door to eligibility errors and fraud and inappropriate payments by removing verification requirements and allowing consumers to simply use self-attestation. Because the agency is silent, because Health and Human Services will not speak on this, we must go to the source, the contractors who have to live in a world. Your world is comprised of contingencies and possibilities, deadlines, and an ever-shifting environment. You know you deal with contingencies all the time. The President's healthcare law continues to create more chaos, more uncertainty for Americans. Since the administration won't admit the enormity and complexity of the task they have undertaken, we have our witnesses today, and I hope that we will hear from them, from these people who are actually preparing the systems, will be able to tell us the real status of the implementation of the Affordable Care Act. And let me then yield to the chairman of the Oversight Subcommittee, Mr. Murphy.